We have with us today virtually Dr. Ayla Azad, Chief Executive Officer, Canadian Chiropractic Association.
I would like to begin by thanking the members of the Standing Committee on National Defence for inviting me on behalf of the Canadian Chiropractic Association and the 9,000 doctors of chiropractic across Canada we represent. I'm sorry I missed you in person on Tuesday, but happy to join you virtually this morning. I want to acknowledge that I'm joining you from the traditional lands of the Haudenosaunee, Huron-Wendat, and Anishinaabe nations, and it is my honor and privilege to be here. It takes 8 years of education and 4,500 hours of clinical training to become a doctor of chiropractic. Chiropractors are trained to be primary care contact professionals with the ability to assess, diagnose, and treat spinal, muscle, nerve, and joint conditions, also known as musculoskeletal or MSK conditions. These conditions, such as back pain, headaches, neck pain, have a devastating impact on Canadians' health, quality of life, workforce participation, and the economy. According to the World Health Organization, MSK conditions, specifically low back pain, are the leading cause of disability around the globe, and more than 11 million Canadians suffer from musculoskeletal conditions every year. Due to the physical demands put on active military personnel, MSK conditions like back and neck pain are double that of the general population. MSK injuries are also a major occupational risk for a military career and are responsible for 42% of medical releases. And these conditions are a key issue for transition services, as 59% of Canadian Armed Forces veterans who report difficult adjustment to civilian life had chronic pain. We are all here today because we want to help our women and men in uniform stay healthy and pain-free. We feel chiropractors are part of the solution, but there are two barriers we want to bring to your attention. Barriers in access to care and inadequate benefits coverage. Yes, armed forces members do have access to some chiropractic care, but in order to receive treatment, they first need to get a referral from the on-base clinician. Most Canadians can simply walk into a chiropractor's office to get care. The requirement of a referral before accessing chiropractic care is not required in any provincial or national health regulation and is not best practice in the health insurance industry. Veterans and the RCMP can seek care when they are in pain without this requirement. There is well-documented research that patient-centered care includes choice of provider, and this results in improved outcomes. Some people respond well to physiotherapy, some people respond well to chiropractic, and some may need both. It seems disrespectful that our brave Canadian Armed Forces members don't have the same choice and require a referral. This requirement also takes time. It takes time to see a physician, and they take a history, they have to perform their own assessment, and then usually the patient is required to first try a course of treatment with on-base staff. And then when that doesn't work, they might get a referral to book an appointment with a chiropractor who then has to go through their own processes. This causes significant delay in accessing care. As a clinician and a chiropractor, I know the sooner I can see the patient, the shorter the recovery period, and the better the outcomes. When care is delayed, acute cases become more complex and potentially chronic. We hear stories of Canadian Armed Forces members waiting weeks to get the required referral, and many are paying out of pocket so they don't need to jump through these hoops. At a time when healthcare human resources are spread thin in the armed forces and across Canada, we need to streamline and reduce duplication. Secondly, the benefits offered through Medavie Blue Cross only cover 10 visits, which might be enough to cover an acute case of injury, but we know that MSK conditions like low back pain can reoccur, and there is a chronicity to them. Veterans, for example, get access to 20 visits. Our chiropractors are ready and willing to follow the protocols and reporting requirements that are necessary to interface with the armed forces, and we already have the training to do so. Culture change is hard and takes time, but we are asking for this committee to encourage the removal of the barriers that are preventing Canadian Armed Forces members from getting the care they need. The prevalence of MSK conditions among active service members means chiropractic can play a role in improving health outcomes and quality of life. We feel that the brave women and men of our armed forces deserve choice and the very best in healthcare. Thank you again for inviting me to appear before the committee.
Dr. Azad, does clinical evidence exist to support the claim that chiropractic care can improve performance or heal a musculoskeletal injury the type that soldiers sustain?
Absolutely. There's more and more evidence showing chiropractic care, manual therapy care, they call it multimodal care, is the best approach for many musculoskeletal conditions. And so, yes, there's guideline after guideline now that talks about musculoskeletal conditions and how manual therapy plays an incredibly important role in first line of care.
Thank you so much for talking about a lot of the conditions that you see in terms of when medical release happens early and the issues. Can you, because I have such limited time, can you quickly discuss that link of chronic pain, how that links to mental health, but then also other systems around the world maybe that's dealing with this in a far better way to avoid that long-term injury, but also that long-term mental health issue?
Thank you so much. I've been fascinated by this conversation because, and Dr. McDaniel's comments, you cannot have mental health without physical health. And he put it correctly, we all need to be working together. So chronic pain and mental health directly connected. 65% of people who have chronic pain will also have a mental health issue, and I believe the stats go both ways. As far as your comment about other models, I know we do things differently here, but around the world, if you look at just south of the border in the United States, they actually have integrated teams on bases. They have chiropractors on staff working together with professionals. We now know that interdisciplinary and integrated models of care is the best way to treat patients because we are not siloed. As someone put it, you can't have mental health but also and not think about all the other conditions that the patient may be going through. It must be a team-based, collaborative approach.